Hi, I'm Catherine Carr, and I would like to share how evidence supports our work in pre-service education, or PSE as we often call it. We all know that there's a need for a strong, highly competent workforce, and we know that pre-service education is part of this package. But what is the connection between a robust pre-service education and a strong health system? Do you need solid information that supports why pre-service education should be included in your work plan? Have you ever had a stakeholder ask, how do you know we should invest in pre-service education? Well, the Global Learning Office has some answers for you. JPIGO's Global Learning Office, or GLO, can provide you with some evidence that supports the integration of PSE into work plans. We conducted an integrative review of PSE literature and found evidence for critical recommendations. From that evidence, we developed a conceptual model for PSE that includes direct inputs, indirect and influencing factors, and how these relate to outcomes for the larger health system. The model, because it is based on the evidence we found in the review of literature, can be used as a framework to develop project strategies, to look at policy. It can be used as an advocacy tool and for project monitoring and evaluation, as well as to develop learning and research agendas. Note that the center of the PSE part of the model on the left-hand side is competence. And competence is what we're looking for when we think about the outcome that we want from pre-service education. Considering all of the aspects of the model, whether they play a major role in your specific intervention or not, will strengthen the work as a whole. The inner circle of the model depicts important direct influences on pre-service education. Each of these is significant in achieving the goal of competence. It's important to note that the success in achieving this goal is less likely if only one factor is strengthened without considering the effect of the others. A supportive infrastructure can facilitate a learning environment where appropriately selected students who are also supported can learn from skilled teachers, tutors, and preceptors. Using a competency-based curriculum and aligning with strong clinical practice sites that support learning are also key to achieving competency. Evidence from our review supports each of these factors depicted in the model. But what else influences pre-service education? This is not a complete list because there are many. Regulation is important for sustaining quality. Accreditation of schools, licensure of health professionals, human resource needs always affect pre-service education. National environment may also be a strong factor in pre-service education. Influences can be positive or negative, and local and regional influencing factors can support or impede PSE. A supportive policy in one area may influence demand in another area. For example, if a policy supporting task sharing is implemented, this may influence the need for more health workers in one cadre. It may require more supervision time from another cadre, and it may require changes in regulatory authorization for the health workers to complete specific tasks. In summary, all parts of the model are important. Emphasis in your project may be on a particular area, but it is important to consider how the whole model influences the work that you do. Are you interested in more information about how factors that influence PSE can lead to better outcomes? Click on the ReproLine Plus link at the bottom of the slide and it will take you to the document of our our integrative literature review, The Health Impacts of Pre-Service Education. This has been a JPIGO Learning Moment with Catherine Carr.